Nearly 80% of all hospital admissions start in the emergency department. I'm Harriet Seeger from Radcliffe Cardiology, and today I have with me Dr. Peter Pang, who works at Indiana University and in two emergency departments in hospitals in Indianapolis. Welcome, Dr. Pang.
Thank you. It's a pleasure to be here.
It's lovely to have you with us, and today we're going to be talking about how best to manage patients with heart issues that come into the emergency department. Who should stay and who should go home? Perhaps you can enlighten us to what the answer really is.
Well, you are asking one of the most important questions, at least that is facing us in the emergency department when it comes to acute heart failure. Of course, obviously, we want to make sure that we take care of the patient first in the sense of ensuring that they are both safe and that we're managing them and ensuring that they feel better. But one of the real questions or challenges that we face is trying to determine who can potentially safely go home. Mm-hmm. And that question of risk stratification is something that we are actively studying.
And how are you doing that? What are the trials taking place at the moment?
So there has been some good work already trying to look at some risk stratification rules. One of the challenges, at least in the United States, is because we admit so many of these patients, almost about 85%, that oftentimes it's been difficult to tease out what's the impact of hospitalization since many of the patients end up getting admitted. Mm-hmm. There has been good work coming out of Canada and Doug Lee's group looking at a risk stratification score. Some colleagues out at Vanderbilt University, Sean Collins, has looked at the stratified decision rule. This is an NIH-funded study that we're also looking to validate. And we're actually trying to send some patients home through some shared decision-making and ensuring good, robust transitional care through a PCOI-funded grant. So these are all kind of new ways of investigating how we might potentially identify low-risk patients who are safe to go home.
Okay. And when we were talking earlier, you mentioned high-sensitivity troponin. Can you tell us a little bit more about that?
Yeah, so this is the fifth-generation troponin assay. We're actually just about to launch a small pilot study here in the U.S. called TACIT. This is not widely commercially available in the United States, unlike, for example, several countries in Europe where you can use the high-sensitivity troponin assay. And at least what we found in some secondary analysis, so these are only hypothesis generating, by no means should we be using this now clinically, is that this may identify patients at low risk. In other words, if you don't have any evidence of myocardial injury or damage, as identified by high-sensitivity troponin, perhaps this is one way that we might be able to identify you as safe to go home. Now, obviously, we have to make sure that we have the right diagnosis and that you feel better and that we have good, robust transitions of care. But this is one of the studies I'm definitely excited about to investigate.
That's fantastic. I mean, presumably patients would prefer to go home anyway, so it's good news for them as well.
Correct. I think so. So I think as all other things being equal and that they feel better and that we can ensure good follow-up care, I agree. I think most patients would prefer to go home.
Yeah, that's super. Well, thanks so much for telling us all about that. And just to also mention, you have an article that you've just recently published with us in Radcliffe Cardiology as well. I know it's a long title, but do you think you can remember it?
No, I don't remember the title either, I'm afraid. But okay. It has to do with lung ultrasound in the setting of the emergency department for acute heart failure. So, I'm not an ultrasonographer by myself. I work with some outstanding colleagues, Francis Russell and Matthew Roots, here at Indiana University. And essentially what we propose is how to look at lung ultrasound from a diagnostic standpoint. That has been pretty well established, which was one reason we were looking at the review and just presenting as a perspective from the emergency department. But areas that we are exploring are actually from a prognostic standpoint, as well as to see eventually could we potentially use this as a way to guide care. Now, those are several steps down the road from a research standpoint, but again, it's easy to use. It's relatively widely available. There's no radiation. There are kind of many ways that I'm slightly biased here. I'm excited about the potential value of lung ultrasound.
That's super. Well, there'll be a link under this video for viewers to find easily. And just wanted to say thank you very much for joining us today. And anyone else that would like to see, we have a whole host of videos and live cases on the website, which is www.radcliffecardiology.com. Thanks so much for joining us today, Dr. Pang.
Thank you for having me.